See what a devastating disease Lyme disease is. You're also dealing with so many other different chronic infections that come along with Lyme disease, not just the Borrelia bug, which is the bug causing the Lyme disease, but there's a whole soup of different infectious agents like the herpes virus, Bartonella, Barbesia, Ehrlichia, and so on and so forth. And as I mentioned earlier, all chronic illnesses are actually caused by the change in the microbiome. And microbiome is all the different bugs that exist within us. A chronic infection is not the idea that all of a sudden there's a bug coming in from the outside causing the illness and there was no bug there before. Statistically, we're actually outnumbered 10 to 1. So for every cell that is us, there are 10 different foreign microbes such as bacteria, viruses, fungus, mold, and parasites that exist. So what we perceive as our consciousness is actually a collective consciousness of all these organisms and you. So it's a whole combined consciousness. And in regards to taking probiotics, because we're thinking we want to have good bugs, just know this, in the gut alone we have about 400 species of beneficial microbes, 400, and each species have hundreds of subspecies. So the estimation is then that we have about 20 to 25,000 different species of microbes in our gut. So when you go to the health food store, you can buy actually pretty much just 2 different species. You can see them in about 100 different varieties, but they're still just only 2 different kinds of species. So the assumption then that when you're taking probiotic, that you get from the health food store, and all of a sudden you're not getting well, and then you're thinking, well, it must be something else. It can't be, there's something wrong with my digestive system or that microbiome. So in the stool, as I mentioned, you have then these 400 species of microbes with all their subspecies. You don't just have 2 bugs there. You have all these 20 to 25,000. So an interesting technique that has been used is what's called a fecal transplant, that you can actually take a little bit of the feces from the mother and then transplant it into the child. Or you can have a healthy individual and transplant it into a sick individual. And that will then introduce a bunch of all these different healthy and beneficial bacteria, so to say. So you can do it very expensively going to a hospital, but there's actually a technique where you just take a little straw. It sounds kind of weird. Take a little straw and you just take the little poop from the mother, and if the child is sick, it's just a young little young little child, you can actually just blow it up in the rear of that little young child, and that will then introduce those beneficial bacteria, which are obviously, you get a whole lot more than just the 2 little bacteria that you get from the health food store. So when you're looking then at wanting to see whether a person is dealing with Lyme or not, the medical so-called gold standard for identifying whether a person has Lyme or not is first doing something that's called the Western blot, which measures an antibodies such as the IgG and the IgM of Lyme, followed then by a blood test called PCR test. These tests frequently show false negative due to some very obvious reasons. The Lyme spirochete has about 250 different genes, so it's a very complex organism, and each one of them is very, very long. So if you put them all together, it becomes roughly the size actually of the Bible. The 250 genes of Lyme contains about the same amount of letters as we have in the Bible. So let's start with a PCR test. It tests about half a page of the genetic material of the Lyme spirochete or some other bug. And if it matches, then you come to the conclusion that this person has disease caused by Lyme or maybe Salmonella or some other infectious agent. The problem is that infectious agents constantly exchange genetic material in order to increase their chances of survival and more effectively actually evade than the immune system. It could be that there's a mold that incorporates actually half a page of the genetic material from the Lyme spirochete. That is the limitation of the PCR testing. It gets worse when we talk about Western blot or the IgG and the IgM testing that I mentioned, where we're testing like maybe one sentence of the genetic material of the bug, and that will then determine whether they say that you have the infections by that bug or not. And as I mentioned, bugs, they continually copulate with each other. So to think that there are very specific different species of bug is actually a very old way of thinking, because they're continually exchanging information and mutating in order to be able to be more effective in surviving, and then, as I mentioned, then evading the immune system. What happens is when a bug learns a technique on how to more effectively evade the immune system, they can actually encapsulate that genetic information, and it's called a plasmid, and then they secrete that into the circulation. So this allows other bugs, like, let's say E. coli, it's floating by, and they can then pick up this piece of information and then incorporate that into their own genetic material. Just like we constantly exchange information with people around us, so do the bugs. They constantly communicate with each other and learn from each other. Bugs are very adaptable to the environment, and they can actually shift shapes depending on its environment. For example, the Lyme bug can change from a spirochete, this little spiral form, to a biofilm, which is kind of like a plaque, and then to a cyst form, which is obviously just a little cyst. Or it can shed actually its cell wall completely and then go inside our cell and hide within our cells. Larger systems like us, we take quite long to change and adapt to the environment. But these smaller organisms, they do it quite quickly.